সুপ্রিয় দর্শক সবাইকে শুভেচ্ছা জানিয়ে শুরু করছি দেশ টিভির সরাসরি এবং নিয়মিত স্বাস্থ্য বিষয়ক সম্প্রচার স্বাস্থ্য কথা অনুষ্ঠানটিতে। আপনার স্বাস্থ্য এবং স্বাস্থ্য সংক্রান্ত যে কোনো সমস্যা এবং তার সমাধান নিয়ে প্রতি বৃহস্পতিবার ঠিক এই সময় আপনাদের সাথে থাকছি আমরা, এবং আমাদের সাথে থাকছেন একজন বিশেষজ্ঞ ডাক্তার। আমাদের আজকের বিষয় ইনফার্টিলিটি অ্যান্ড ট্রিটমেন্ট। এই বিষয়টি নিয়ে কথা বলবার জন্য আমাদের সাথে আজকে স্টুডিওতে উপস্থিত আছেন ডক্টর অরুণ মুথুভেল, রিপ্রোডাক্টিভ মেডিসিন অ্যান্ড সার্জারি, ঈশ্বরিয়া ফার্টিলিটি সেন্টার, চেন্নাই। সুপ্রিয় দর্শক, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 8332509 8332754। দর্শক, আমি আবারও বলছি, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 8332509 8332754। Hi Arun, how are you?
Yeah, fine.
It's our immense pleasure to have you in our show today. Okay, we are going to discuss about infertility and this treatment, which is called in Bangla that bondhotto. Like the word is came from that bondhotto is infertility. So today's topics is actually we are discussing that we will discuss about IVF, in vitro fertility. So before going to that topic, I just want to know from you that in case of infertility, we have a definition in our country, like the global definition is the same. But what you actually consider about, or what, as you are working in a fertility center, so what you consider as infertility?
Okay. What we see is that when a couple is married and the female has a regular cycle, they should try to conceive for at least minimum of 12 months, 1 year, or at least 1.5 years. And if they don't become pregnant, we label them as infertility. Suppose the women has irregular cycles, we don't consider that as infertility. We make them ovulate every month using tablets or injections. They have to try continuously for 12 months, and if they don't conceive, then we label them as infertility.
Infertility, okay. So the definition in Bangla, it comes like বন্ধত্ব মানে হচ্ছে যদি আমরা কোনো একটা কাপলের যার কোনো মাসিকের সমস্যা নেই বা মাসিকের সাইকেলের সমস্যা নেই, তার 1 বছর চেষ্টা করার পরও যদি তারা বাচ্চা ধারণে সক্ষম না হন, তাহলে আমরা তাদেরকে ইনফার্টিলিটির ক্যাটাগরিতে ফেলবো। এবং যাদের মাসিকের সমস্যা আছে, তারা যদি ওষুধ খাওয়ার পর তাদের সাইকেল রেগুলার হওয়ার পর তারপর যদি 1 বছর সময় পার করার পর বাচ্চা না হয়, তাদেরকে আমরা আসলে এই ইনফার্টিলিটির ক্যাটাগরিতে ফেলবো। Then I just want to ask you that what is the indications of being starting the treatment of ovulation induction drugs or things? What are the signs and symptoms you consider that you will go for the drugs or you will go for the injections or other medications?
Okay. First, what we do is that if the female doesn't have regular cycles, we have to evaluate what is the reason for irregular cycle: overweight, thyroid problem, prolactin problem, hormonal problems. So we have to correct that first. Even after correcting, some women will not ovulate, they will not have regular cycle every month. So first step will be to use tablets, so ovulation induction, oral tablets. So we have to use oral tablet for at least 3 to 4 months. If the tablets are not working, then the next step is to add little injections in the cycle and try for another 3 cycles. Even if that is not working, you have to use more injections, exclusively injections from second day of cycle for at least 8 to 9 days. So this is a step. So we generally advise.
This is the normal protocol. But in case of male, if there any is there any evaluation of male you do?
Yeah, whenever a couple visits an infertility clinic, the first step is to definitely do a semen test, semen analysis. So you have to look for the count, motility and morphology. So this is very, very important.
So the thing is not only the women are the concern, also the male are the concern, because now in our country like ours, also in India, in some states, that always they accuse the women for the infertility, but nowadays we know that the 50-50 are the involved in infertility issues. So in case of drugs, if you are saying that if you give the ovulation induction drugs, what is the indication, like what are the issues happens when you are using the drugs? When they came to you, what are the signs symptoms they say you, or you choose the drugs, or you sometimes some doctors give direct IVF indication. That is another cases. But if a couple comes to you, if you go for the ovulation induction drugs, what are the indications?
Okay. So ovulation induction generally is given 1 to 2 years of infertility or maybe 3 years. We don't suggest IVF at all. So first step is evaluate all the causes, hormones, all these things, semen count, everything rule out. The next step is to evaluate the tubes, make sure both the tubes are open. Then next step is to go for
After
ovulation
trying
induction.
1 or 2 years, if they come.
Correct.
Okay.
So we try ovulation induction. After they exhaust, say 1 year or 2 years of trying naturally, if they don't conceive, we start ovulation induction. But suppose if the couple gets married very late, say they are 35 years old, they get late marriage, we start ovulation induction immediately, even after 6 months. We don't wait till 1 year or 2 years. We
Okay.
start in
Okay.
6 months
So
also.
this is another point, that not always you suggest like 1 year indication induction.
Exactly.
And if the couple are aged, if they get late marriage after 30 years, when the high risk pregnancy happens, then you go for after 6 months the inductions.
Correct.
They you do you ask them to try for 6 months or more than 6 months that time?
No. When the women's age is more than 35, we definitely advise them to try for naturally for 6 months, not more than that, because as the age goes higher, the number of egg comes down. So we shouldn't ask them to try naturally for a long time, then we'll risk losing the eggs.
Okay. So that's why you ask them to try for at least 6 months, then come to yours.
Correct.
Okay. What is the indication of injections? Why you go for the injections if the drug fails? This is a common problem. But what are the other issues that you go for the injections?
Okay. There are two reasons. One is women, they develop resistance to that oral ovulation drug. Other one is failure. The tablet will work, but pregnancy will not occur. That is drug failure, resistance failure. So for both these reasons, we have to go for injections. That is one thing. And whenever
how you evaluate these things, that drug failed or drug resistance developed?
We have to use it for at least 3 to 4 months. Only then we'll be able to know. Without using, it's very difficult to predict. And one more thing is, when the women's age is more than 30, it's better to use injections directly with little tablets. If the women's age is less than 30, start with tablets. So whenever there is less time, when the age goes up higher, start injections. When we have plenty of time, age is young, use tablets.
So is there any side effects of injections or anything of using ovulation induction tests without proper monitoring?
Yeah, definitely monitoring is required. Sometimes what happens is, when the women is thin built, young patients, if you use tablet, they may hyper respond. Instead of 2 or 3 follicles, they may develop 10 follicles. So there will be enlargement of the ovary, so it's risky. So definitely monitoring is required. That is one thing. One more thing is, if you use injection, there is a very high chance of hyperstimulation. So you have to definitely monitor. Monitoring, there is no excuse for monitoring. You have to monitor.
So you have to the monitoring system. You always suggest them by your follow-up procedure, or you say just to do the ultrasonograms by themselves?
Monitoring, easiest is by ultrasound. In a country like India and Bangladesh, definitely ultrasound is not very expensive. So monitoring by ultrasound is okay. Whereas in Western countries, ultrasound is very expensive, so they do urine test monitoring, LH, they monitor LH for ovulation and then they plan.
But in case of our country or India, like we go for the TVS, transvaginal sonography. Okay. So now we are going to the topics that IVF, that in vitro fertility, which is called test tube babies in general. People will understand that in case of IVF, actually what are the all indications? Because some people got frustrated if they are giving IVF, why the doctor suggested me IVF, or what are the actually indications should be in IVF?
Okay, so we'll
some malpractice also over there, because nowadays it is so many value adding cost effective treatment. So some hospitals or some maternity clinics without less skill, less experiences, they are doing all the things. But what should be the protocol, or what should be the actual proper indication for IVF?
Yeah, we'll divide the indication into male and female. So male, whenever the sperm count is very low, say less than 5 million, and motility is also very poor, less than 10% motility, definitely you have to go for IVF. Next is azoospermia. When they don't have any sperms, you have to go for IVF. You don't have. These are the two indications for male.
For male.
For male. Female, what you have to see is that we have to see the women's age. If the age is more than 35, you can be little liberal. If the age is less than 35, you can go little slow. The first important factor is the tubes. If both the tubes are blocked, you have to go for IVF. But before going for IVF, you have to confirm by doing a laparoscopy. That's the first step. The next important indication is PCOS. So irregular cycle, polycystic PCOD, whatever. So what we do is that we ask the couple to go out with ovulation induction for at least 3 to 4 cycles. If they don't conceive, next step is to do with injections, same ovulation induction, and try IUI. IUI for 3 to 4 cycles. If they still don't conceive, next step is to intrauterine insemination. Okay. If they still don't conceive, next step is IVF. Then there is one more important indication is endometriosis. People are actually underestimating the problem.
And
So,
this is a very alarming problem, because rather than PCO and other things, endometriosis is very
very
alarming
severe problem. So
Okay.
endometriosis, the important thing we should understand is that surgery is not a permanent treatment. Even if you do a surgery, the disease is going to come again and again. There is no permanent treatment. You can't do surgery again and again. So in case of endometriosis, if it's mild, you can do intrauterine insemination. If it is severe, there is a big cyst, definitely you have to go for IVF. The reason is that if you don't go for IVF, the cyst will grow, it will go to the next ovary, it will keep on spreading, and the number of eggs will start reducing. If the number of eggs reduces, then you will not get good eggs in IVF. Even in IVF, it's very difficult.
Yeah, it's difficult.
Very difficult.
So you are saying the issues of male. So if they have like any ovulation inductions drugs in like women.
Sometimes even men will have hormonal problems. It's called hypogonadotropic hypogonadism. The testosterone level may be low, the sperm is less than 5 million or even 0. In those cases, you have a scope of improving them. So you can use the same drug, clomiphene citrate, for 3 months, 4 months, and even HCG injections weekly twice to improve the sperm count. So even they have a scope. Similar ovulation induction drugs can be used in men also to improve the sperm count.
Okay, so we just did not suggest them for IVF. We first give some medication according to indication. Then if they improving, then we try for the medications and injections. Then we go for the IVF.
Correct.
Okay, so in case of IVF in your fertility center, because in Iswarya Fertility Center is very much popular, all of the doctors and all of the patients who are going through infertility, they also know if they want to go for treatment in Chennai. So in Iswarya Fertility Center, what you would do actually with the patients actually when they come, what is the protocol you maintain for IVF or other things, and how you maintain like this?
Okay. The first step what we do is complete evaluation. When a male comes, we do basic blood test, hormone test, and a semen analysis. We evaluate complete male picture is got. The next step is females. So females, what we do is we do a routine basic blood test, transvaginal ultrasound, TVS scan. The next step is checking your hormones, thyroid, prolactin, and one more important hormone which we check is the AMH. So AMH gives you your egg reserve, ovarian egg reserve. Same like how you check for number of sperms in men, you can check for number of eggs in the ovary. This is AMH. So we finish all these checks. Then next step is to go for hysteroscopy. This is where actually we are expert in. So hysteroscopy is nothing but putting a camera inside the uterus and seeing what is the problem inside. Many doctors, what they do is that they do laparoscopy, but they don't do hysteroscopy. That's a major mistake. When you are subjecting a patient to anesthesia, another 5 minutes extra you are finishing hysteroscopy. In hysteroscopy, sometimes you may find polyp, fibroid, all these things which will be missed by scan. Scan is what is like a black and white. Sometimes you may miss small things. Whereas with hysteroscopy, you are seeing with your eyes. So you will not miss anything.
A proper way of seeing the problem
uterus.
actually.
Yeah.
Okay. In case of laparoscopy, if you go for the ovulation blockage of the tubes, if we go for the laparoscopy, then what is the how you counsel the patient, because sometimes they don't want to go for the laparoscopy or some things. Then how you counsel the patient, what you say, or what are the responses of the patients?
Okay, very simple.
Because in case of in our country, laparoscopy is not that much popular. Not for the doctor can do, they can do, they got training, they have training, but the people or patient don't allow for the laparoscopy. They want to go for the IVF rather than laparoscopy if they have any problem or anything. So what is the point of your counseling to the patient in case of laparoscopy?
Okay, whenever your age is less than 30, definitely there is a big role for laparoscopy. You will be checking the tubes with HSG, hysterosalpingogram. So hysterosalpingogram will tell you whether the tubes are open or not. It won't give you any other information. Whereas when you do laparoscopy, you can check for peritubal adhesions. The tube will be open, but still there will be some adhesions. The tube will be attached to the pelvic wall or to the ovary. So the tube will be open, but it will not go and pick up the eggs. So if you do laparoscopy, you can clear all those adhesions. You can make the tube nicely open. That is one thing. Next, if there is any tubal infection, you can diagnose with laparoscopy. And as I told you, when you do hysteroscopy, you will be flushing the tubes. So even the tube is open, it will be nicely open. So the chance of conceiving naturally after laparoscopy is very high.
It's very high.
Very high. And one more important thing is case selection. So which kind of patients you are subjecting to laparoscopy is important. Younger patients, very good success. But when the age is more than 35, even laparoscopy may not be the right option. And with endometriosis, definitely
So
laparoscopy is
age
another
issue
option.
is the main concern in infertility.
Correct.
Because in IVF also, in ovulation induction drug also, injection also, and laparoscopy also, it came out with less results. So in case of laparoscopy, you were saying that if the tubes are blocked without other complications, you may open the blockage by doing the laparoscopy, so that the ovulation can happen normally, or the pregnant girls. So how is the ratio, what is the ratio, what is the data you have that after laparoscopy they got pregnant? Do you collect the data in your center, or do you have any experience that it happened?
Yeah, after every laparoscopy we follow the patient for next at least 1 year, and we try to collect data whether they conceive naturally. 80 to 90% of the couples who undergo laparoscopy with us, they follow us for treatment. Only when the couple comes from abroad, sometime we may lose follow up. And if you see, out of 100 people doing laparoscopy, at least 10 will conceive naturally without any treatment in the next 1 or 2 months. If you wait for 6 months or 1 year, at least 20 will conceive. And if you give them ovulation induction after laparoscopy or do IUI, 30% conceive. So the case selection is very important. At what age you are doing laparoscopy
So we
is very
have a
important.
phone call, we are receiving that, after we will come back. হ্যালো দর্শক, আপনার নাম বলে প্রশ্নটি করুন।
আসসালামু আলাইকুম। আমি আমি কুমিল্লা থেকে বলছিলাম।
জি।
হচ্ছে 10 বছর যাবত।
জি।
এখন আমার মোটামুটি সবগুলো টেস্ট শেষ, বাট এই হাইপোথাইরয়েড হরমোনের সমস্যা আছে। আর আনুষঙ্গিক সমস্ত কিছু ভালো, হাজবেন্ড এবং আমার অন্যান্য সবগুলো ভালো, কিন্তু মেন্সের সমস্যা হয় আর কি।
আচ্ছা ডক্টর, দর্শক আপনার বিয়ে হয়েছে কত বছর?
10 বছর। আমার বয়স 28।
আচ্ছা, আপনি এর মধ্যে কখনোই কোনোদিন কনসিভ করেন নাই?
না না না, কোনো সময় কনসেপ্ট হয় না, অনেক ডাক্তার দেখাইছি।
আচ্ছা, তো কোনো সমস্যা বলেনি যে কেন হচ্ছে না বাচ্চা?
এখন ওনারা বলে যে হাইপোথাইরয়েড সমস্যা তো এজন্য হয়তো বা হচ্ছে না, বাট হবে বলে, কনসেপ্ট হয়ে যাবে, এই বুঝি হয়ে যাবে, এরকম করতে করতে আজকে 10 বছর প্রায় শেষ এরকম।
আচ্ছা, আপনি লাইনে থাকুন, আমরা উত্তরটি নিচ্ছি। The patient is actually married for 10 years. She is 28 years old, but she is saying that her husband doesn't have any problem. She also doesn't have any problem rather than hypothyroidism. So for hypothyroidism, doctor is saying that she can't get pregnant or she is not conceiving. So what should be the suggestion?
Hypothyroidism per se is not the cause of infertility. Hypothyroidism causes luteal phase defect. After you ovulate, the luteal phase is defective if you have hypothyroidism. But if you correct your thyroid hormones, this problem will be rectified. You are married for 10 years, so definitely it is not unexplained infertility. There should be some reason. So the logical step is, since your age is only 28.
Proper evaluation should be needed here.
Proper evaluation. Maybe laparoscopy can also be
hypothyroidism
considered.
problem is not the problem of heart. ওকে দর্শক, আমরা যে উত্তরটি নিয়েছি, শুধুমাত্র হাইপোথাইরয়েড থাকার কারণে আপনার বাচ্চা হচ্ছে না এরকম হওয়ার কথা নয়। যদি আদার্স কোনো প্রবলেম থাকে তাহলেই সেটা বাচ্চা না হওয়ার কারণ হতে পারে। আপনার উচিত যে কোনো একজন গাইনোকোলজিস্ট বা একজন ইনফার্টিলিটি স্পেশালিস্টের কাছে যে আপনার সমস্ত সমস্যাগুলো আবারও ইভ্যালুয়েট করা, আবারও ভালোভাবে হিস্ট্রি দিয়ে তার কাছ থেকে জেনে নেওয়া যে আপনার ইনফার্টিলিটির সমস্যাটা কি আছে। কারণ হাইপোথাইরয়েডের জন্য যদি আপনি ওষুধ খান, মেডিকেশন আছে, সেগুলো খেলেই সেটা কারেকশন হয়ে যায়। সেক্ষেত্রে হাইপোথাইরয়েডিজমের জন্য বাচ্চা নেওয়ার কোনো ইস্যু থাকার কথা না। আপনি একজন ডাক্তারের কাছে শরণাপন্ন হন, তিনি অবশ্যই ভালোভাবে ইভ্যালুয়েট করে বের করবেন যে আসলে কেন বাচ্চা হচ্ছে না। দর্শক, অনেক ধন্যবাদ আমাদের প্রশ্নটি করার জন্য। What we were discussing, that in case of laparoscopy, if we go for the normal procedure, we can make pregnant for 10% of women. If you go for ovulation induction drug with laparoscopy, then more than 10% or 20% it happens. If you go for the IUI also, so in case of IUI, I just wanted to tell you that in case of IUI in our country, it is actually treatment is of a male fertility. If the motility problem is there, or the husband is staying in the abroad for a long period of time. So in what is your decision about IUI, or what is the indication of IUI?
IUI again, like I told earlier, male female indications. For male, like already you pointed out, husbands are going abroad for job, that is one reason. Husband has any sexual issues, he is not able to have good erection, all these things, he can do IUI. And third thing is, when the count is borderline, even the motility is borderline, you can't do IUI for a very low count or a very low motility, but if the count is okay, average or borderline, or the motility is okay, you can go ahead with IUI. This is for male. For female, the indication is unexplained infertility. When everything is normal, you can do IUI. Next, when you have a PCOD problem, ovulation induction has failed, when you have used induction, definitely IUI has a role. Third thing is, like I told you, age more than 35, married for more than 6-7 months, you are not becoming pregnant, definitely IUI is a very good option. So these are the broad indications for IUI.
IUI, Julie, but what do you think that what are the outcomes of IUI? Is it equal to ovulation induction drugs and injections, or it may makes out more effective results?
Okay, with IUI, you get 20% more pregnancy than ovulation induction. Suppose you do ovulation induction for 100 people and suppose say 20 conceive. If you do IUI for this particular 100 people, 30 will conceive. So definitely there's a improvement in pregnancy rate.
Okay. So is there any complications with that?
IUI per se there is no complication. The only complication is that when you use injection for ovulation induction or IUI, sometimes 2 or 3 follicle may develop.
More than one.
So there is a chance that you may develop twins, triplet, multiple pregnancy. So that risk is there. One more risk is ectopic pregnancy. Sometimes when you have too many follicle, too many eggs, one or two embryo will get
in the tubes.
So you will have ectopic pregnancy. That is one more.
So we will come again to the topic. Another phone call is there. Hello, দর্শক আপনার নাম বলে প্রশ্নটি করুন।
জি, আমার নাম প্রিয়াঙ্কা।
জি।
আমার বিয়ে 6 বছর, আমার কনসেপ্ট করছিল বিয়ের 3 বছর পরে।
আচ্ছা।
তারপরে বাচ্চাটা নষ্ট হয়ে গেছে, ডিএনসি করা হয়েছে। তারপরে এখন আর কনসেপ্ট করতেছে না। তখন বলছে যে আমার মোলার হয়েছিল।
আচ্ছা, মোলার প্রেগন্যান্সি ছিল।
জি।
এখন কনসেপ্ট করতেছে না। এখন কনসেপ্ট না করার জন্য ডাক্তার কি কোনো ওষুধ বা কিছু দিচ্ছে?
হ্যাঁ, আমি ল্যাকটোল খাইছি 2-3 বার। ডাক্তার দিছে, তো কোনো কাজ হইতেছে না। তো বলছিল আমার ল্যাপ্রোস্কোপি করার জন্য, ল্যাপ্রোস্কোপি করা হয় নাই। এই
আচ্ছা, ঠিক আছে, আপনি লাইনে থাকুন, আমরা উত্তরটি নিচ্ছি। The patient is asking that she is married for 6 years. She got pregnant in 3rd year of her marriage, but it was a molar pregnancy, so she lost the baby. But now she is trying, she is not conceiving. Doctor is suggesting for laparoscopy, and she is going through lateral and other ovulation induction drugs. So she didn't do the laparoscopy. So what is your suggestion? What she should do?
What was her age actually?
Actually, আপনার বয়স কত দর্শক?
24 বছর।
24.
Oh, 24. What I will suggest is that you can do IUI directly for at least 2 or 3 cycle. If you don't conceive, then you can plan laparoscopy because the age is only 24. So you're not
So
in
you
a
are suggesting her IUI for consecutive 2 cycle, or first cycle she should try, then taking a break, then another cycle?
IUI generally it's better to try continuously rather than taking a break. The effect will be good.
Okay.
If you take a break,
she
it
doesn't
is
want
not
to do the laparoscopy. Okay. দর্শক, আমাদের সাথে যিনি ডক্টর রয়েছেন উনি সাজেস্ট করছেন যে আপনি যদি আইইউআই, যেটা ইন্ট্রাইউটেরাইন ইনসেমিনেশন, যেখানে আপনার ওষুধ দিয়ে আপনার ডিমটাকে বড় করা হবে এবং আপনার হাজবেন্ডের যে সিমেন আছে সেটা নিয়ে তার প্রপার প্রসেসিং করে আপনাকে ওরা একটা টিউবের মাধ্যমে আপনার ওখানে দিয়ে দেওয়া হবে, এটাকে আইইউআই বলে, ইন্ট্রাইউটেরাইন ইনসেমিনেশন। এটা যদি আপনি পরপর কয়েকটা সাইকেল করেন তাহলে আপনার সম্ভাবনা আছে প্রেগন্যান্সি ডেভেলপ করার। এই বিষয়টা নিয়ে আপনি ডাক্তারের সাথে কথা বলতে পারেন যে আমি আইইউআই যদি করতে চাই তাহলে আমাকে কি করতে হবে। তাহলে বাংলাদেশে যে ডাক্তাররা রয়েছেন যারা চিকিৎসা আপনার করছেন তারা এই ব্যাপারে আপনাকে সাজেশন দিতে পারবেন। দর্শক, অনেক ধন্যবাদ আমাদের প্রশ্নটি করার জন্য। Okay, we are discussing about the complications of IVF. You are saying that a twin triplex it happens. So it may happen in ovulation induction drug also.
Correct.
Okay, so now we are going to the IVF. That in case of IVF, if a Bangladeshi doctor suggests, maximum times it is suggested directly that you got patient from Bangladesh or other places that they come to that we want to do IVF. Okay, so if this type of cases comes to your house or infertility center, what you go through, go with this patient, what you do with these patients?
Okay.
You go directly to the IVF or you do some evaluations, or what you suggest actually?
First we do a detailed evaluation. So after we do the evaluation, what we do is we counsel the patient. We give them proper counseling. Sometimes it's 30 minutes, 40 minutes counseling. We see what is their expectation. Some may have family pressure, personal reasons. So if there is something like that, okay.
In case of country like ours, the family pressure is the main issue. In case of our country, if we consider Bangladesh, the family issue is the main issue. Then they come, they go to yours. Then you direct suggest that IVF before that you go for some evaluation. Is the evaluation is like ovulation induction drugs given or injection given like this?
Yeah, what we see is that first we classify patients. If there is a very good chance of conceiving naturally or by ovulation induction, we definitely allow them for ovulation induction and IUI, all these things. If there is no scope, say a couple is married for more than 10 years and very bad history, tubes are bad, we directly advise them IVF. So we
And
actually
there are so much
classify.
impatience for having a baby or other
True.
thing, you go for the IVF. So before going IVF, what you do with the patients, what the diagnosis is or what the test you go for?
Yeah, like I told you earlier, first we do is complete evaluation of male, like basic blood test, hormone test and semen analysis. For female, again the basic ultrasound is the first step. We rule out if there is any cyst, any other hydrosalpinx, any problem in the tubes, uterus, endometrium, any polyp. The next step is doing a hormonal evaluation, thyroid, prolactin, AMH, anti-Mullerian hormone, basic blood test and the cavity evaluation by hysteroscopy. So with this we will get a complete picture. Based on this we will plan IVF. For some people, if there is a problem, we don't do IVF. We ask them to go back, come after 3 months, 4 months, rectify all these problems, hormonal problems, then come back. So we never push them for IVF directly. We see what is the problem, we suggest solution based on that.
If there are any hormonal problem or anything, you focus. So in your fertility center, is there any complete package for this, that you, if the patient has the hormonal problems, you give the medication, or you have another doctor for the hormonal medications or hormonal treatment also?
Okay. In our fertility center, all our doctors are mostly qualified in infertility also. Generally, gynecologists handle infertility in many places, but in our center, most of our doctors are all.
Only you practice infertility. Okay, so that's why when a patient comes to you, if there are any hormonal problems or any other pathological conditions is there, you by yourself do the treatment. Okay, we are taking a short break. After that, we will discuss about the process of IVF, what we actually do in IVF, and what are the outcomes of your center. We will discuss about it. সুপ্রিয় দর্শক, বিরতিতে যাবার আগে আমরা কথা বলছিলাম আজকে ডক্টর অরুণ মুথুভেলের সাথে। আমাদের আজকের বিষয়টি হচ্ছে আইভিএফ টেস্ট টিউব, যাকে আমরা বলি সহজ বাংলায়। এই বিষয়টি নিয়ে উনি কথা বলছিলেন এবং উনি বলছিলেন যে আমরা আমাদের যে ট্রিটমেন্ট প্রসিডিউরটা নর্মালি বাংলাদেশে করি সেভাবে ওনারাই ট্রিটমেন্ট করেন, কিন্তু যদি আইভিএফ এর জন্য আমরা কখনো কখনো চেন্নাইতে যাই বা আমাদের দেশের বাইরে কখনো কোথাও যাই, তাহলে ওনারা সাথে সাথে আইভিএফ করবেন এরকমটা নয়। ওনারা পুরোপুরিভাবে ইভ্যালুয়েশন করবে, আপনার হিস্ট্রি নেবে, আপনার হাজব্যান্ডের হিস্ট্রি নেবেন, এবং সবগুলো যদি ওকে থাকে এবং তাদের মতো করে তারা যদি এটাকে ওকে পান, তাহলে তারা শুধুমাত্র আইভিএফ করবেন। সুতরাং এই ধরনের ধারণা নিয়ে কখনো যে যাওয়াটা উচিত হবে না যে আমি যে আইভিএফ করব বা এরকম। আগে আপনাকে প্রপার ইভ্যালুয়েশন তারা করবেন, আপনার যে সমস্যা আছে সেগুলো তারা বের করবেন। যদি ফার্দার সমস্যাগুলো তারা ট্রিটমেন্ট করতে না পারেন এবং সব কিছু মিলে যদি ওকে থাকে, তখনই তারা আইভিএফ করবেন। আইভিএফ আমরা কীভাবে করব এবং কীরকম কস্টিংটা হতে পারে চেন্নাইতে, আমরা সেটা বিরতির পরে এসে জানবো। তার আগে একটি বিরতি নিচ্ছি। সুপ্রিয় দর্শক, বিরতি শেষে আবারও ফিরে এলাম স্বাস্থ্য কথা অনুষ্ঠানটিতে। আমাদের সাথে থাকার জন্য ধন্যবাদ। আপনার স্বাস্থ্য এবং স্বাস্থ্য সংক্রান্ত যে কোনো সমস্যা এবং তার সমাধান নিয়ে প্রতি বৃহস্পতিবার ঠিক এই সময় আপনাদের সাথে থাকছি আমরা, এবং আমাদের সাথে থাকছেন বিশেষজ্ঞ ডাক্তার। আমাদের আজকের বিষয় ইনফার্টিলিটি অ্যান্ড ট্রিটমেন্ট। সুপ্রিয় দর্শক, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকে বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 833-2509, 833-2754। Arun, we are discussing about indications of IVF and many other things of infertility, what we can go for the treatments, and including IUI, laparoscopy, ovulation induction medication and injections also. So in case of IVF, if a patient comes for the IVF, you go for the evaluations and go other things to maintain the patient. So what is the time frame actually? What is the time